welcome back to the Standard Podcast. I am Pastor Kelly Ogwezi, but you can just call me PK. And I'm joined by my best friend in the entire universe, Rara. Hey, bestie.
Hey, boo.
So the Standard Podcast, I'm really having a great time doing this, by the way. What about you?
Of course.
I know y'all have just fallen in love with us, so we're just so excited to share something. How do I describe today's topic? Maybe controversial a little bit.
Yeah.
Ethical for sure. But the Standard Podcast was created for you, the listener, for the woman who didn't plan to be a disruptor, but life left her with no option.
Yeah.
A woman who is a disruptor is one who intentionally challenges systems, mindsets, and patterns that keep people, organizations, or cultures stuck. I always say culture's weird. Is that weird? Cultures.
It's okay.
Okay, cultures. Stuck while introducing a new, higher standard of truth, order, or possibility. This podcast is for the woman who is not cool with dysfunction.
Okay.
Like, no. So, are you ready for today's topic? We're just going to jump right in. Are you ready for this?
I'm ready.
You ready to hear the name of it?
Yes.
Secrets in the Sheets.
Ooh.
Secrets in the Sheets.
Okay.
Okay, so before we jump to conclusions, all right, I'm sure people are going to be like, oh, what are they talking about today? Or before you judge, right? Before anybody makes any type of judgment, although I'm sure somebody just judged me when I said secrets in the sheets. But anyway, before you judge, ask yourself this. If something about you could change how they saw you, would you tell them on date one or never? So let me repeat the question, all right?
Okay.
Before you judge, ask yourself this. If something about you could change how they saw you, would you tell them on date one or never? So today I want to talk about 3 things that I think are kind of controversial.
Okay.
And I'm going to get your opinion on it. If someone has HIV or AIDS, should or when should they disclose? Also, HSV-2, which is genital herpes. And also, just to throw in a little bit extra, erectile dysfunction.
Gotcha.
Should these things be disclosed? Should they be disclosed like from the jump or as the potential relationship evolves?
Yeah.
Like, I don't know. And I've had people ask me this question before, you know, particularly with herpes, you know, when should I tell? Like, when should I disclose the information?
Yeah.
And then my personal experience with the HIV and AIDS diagnoses when I was in nurse practitioner school, I don't know if you remember that, but I worked in the HIV clinic.
I don't remember.
Yeah, it was a part of my clinical rotation.
Yeah.
And I vividly remember one of the questions that we had to ask with each patient was, we framed it like this: what do you do to keep yourself protected during sex? Right. So not like, what do you do to protect
your
them,
partner,
but to protect you?
Yeah.
Do you disclose? You know, so we were taught to like word it that way.
Yeah.
And I would say about 50-50. I got a 50-50 response from my patients. Some of them, literally, I'll never forget this one guy told me, and he did have AIDS. Young guy, he was a football player at a local college. And he said, I just go with the flow. And I almost got under the table because I was like, oh my God. But that's the reality of it. You know, it's one thing not to know, but when you know, then what do you do? So where do you draw the line between privacy and deception?
All right.
So what's your take on this?
I guess, to me, it depends on what you're trying to get out this relationship. If it's just going to be a simple, I call you on the phone, we might go out to eat type situation, then I don't think you, per se, need to tell the other person your personal business at that point. But if you see the relationship is progressing, even with and you think potentially You might have a sexual encounter with that person.
Be proper with this thing, Bestie. That's right. A sexual encounter.
You definitely need to allow that person to choose whether they want to continue on and do a sexual encounter with you, or if they decide to do it, they just want to wear protection or not. Like, that's something you cannot, if you're going to change someone else's life, potentially, then you need to have them to be involved in that decision. So keeping it a secret, I think, is no if you plan on having a sexual encounter.
Yeah, and I don't think you show up at the first date, with a medical portfolio.
Yeah, definitely not.
Saying, by the way, I have this, this, and this.
Yeah.
But I do feel like, as if it actually grows into something, because everybody that you talk to or date doesn't grow into something. But if you do, but then you may have the question, well, why didn't you tell me sooner? Then you have some people who actually have sex and then tell.
Then tell, right.
I think it's deception, I guess. I understand why somebody might not want to disclose.
Right.
But it's like you telling me after the fact, after you've already potentially put me at risk. I don't know.
I don't have the issue with you not telling me. I have an issue with you not telling me and then you want to proceed further in the relationship.
Before sex.
Right.
Right. Like, if it's not going to that, you don't have to tell.
Yeah, you shouldn't have to tell.
Right. So here we go. Got some things to look at, because for those who don't know, we're both nurse practitioners. So we decided to put a little twist on this episode and kind of bring about awareness, because we do have a responsibility to do that. So let's tackle this issue. You ready, Bestie?
Yes.
Okay, so number one here, a global snapshot of herpes. And we know this, but this may help someone. If you go to the clinic and you request an STD screening, they're not going to screen for herpes. So you have to specifically say, I want a screening for, you can say HSV1 and 2, but HSV1 is the oral, like the cold sores that you get. But HSV2 is the one that causes genital herpes. But we don't even check for it in the clinic. We check for gonorrhea, chlamydia, trichomonas, HIV, AIDS, syphilis.
Yeah.
And that's it. That's everything outside of herpes.
Why do you think they don't directly check for herpes without you asking?
Because more people have it than you realize. It's very common.
Right.
And some people have it and may have never had an outbreak, or may have had one outbreak and they dismiss it because it never happened again. That's what I think. It's almost like it's so common. As a matter of fact, let me give you some stats on it. So over let me tell you how common it is. Over 3.8 billion people under the age of 50 have HSV1. So that's the
cool source.
Yep. And approximately 520 million individuals between the ages of 15 and 49 have HSV2. 520 million people. So in 2020 alone, around 205 million people in that age group experienced at least one symptomatic genital herpes episode. So out of the 520 million, a little less than half, right, actually had an outbreak. And overall, more than 846 million people between the ages of 15 and 49 are living with it worldwide.
Yeah.
So basically, globally, that's 1 in 5. So that number of 846 million is the combined number of oral and genital. Yeah. But basically, 1 in 5 people have herpes, and there's 4 people in this room. I'm just playing, y'all.
So
I'm just trying to give you an idea.
Yeah.
Everybody dropping their heads. But anyway, but being for real now, like seriously, that's how common it is, 1 in 5. And I pulled this, I want to say from the World Health Organization. Okay. Now, when it comes to HIV, I personally think that one is of a greater severity, But as of 2024, 40.8 million people worldwide are living with HIV. 39.4 million of them are adults. 87%, get this though, 87% of people with HIV know their status. So that's a big improvement, right? Because that was like a big thing years ago. Like when we were in school and stuff, like get tested, know your status. Like we know now we have like rapid HIV testing.
But when we were younger, HIV was a death sentence.
And now
it's no longer a death sentence.
Right.
Which is awesome.
Man.
Yeah.
Yeah. Matter of fact, I want to look up something. Y'all know I like to look up stuff. So, yeah. Because with the HSV, because we were talking about why aren't people screened for it?
Yeah.
Because, we weren't taught to screen for it. That's according to the CDC guidelines, of course. Like, it's not required. It doesn't recommend universal HSV screening for the general population. Now, if you have another STD, it may prompt you, because that's what I would do. Like if somebody has come in and said they've been exposed to something,
right,
I don't run a whole panel. I will, but it's still up to the provider. But a standard STD panel, like we spoke of already, chlamydia, gonorrhea, syphilis, and HIV. Oh yeah, and sometimes hepatitis.
Yeah.
I forgot about that. And sometimes hepatitis. But unless you specifically ask, as we aforementioned, you won't get screened for herpes. So you may think you're in the clear because you didn't test positive for any of these things.
Yeah.
But there is a possibility that you could still have HSV 1 or 2. And according to the CDC, more than 50% of adults in the U.S., now this quote from the CDC says 1 in 6, and then the WHO says 1 in 5. Okay. But some never show obvious symptoms, or they mistake an outbreak for a razor burn or ingrown hair.
Ingrown hair.
Isn't that something?
Yeah.
And here we go. We were right. Because it is so common and often asymptomatic, routine testing will lead to a huge number of positive results. So we were right. That may not change medical management, because unless you have, so many outbreaks in a year, you're not going to get put on medicine, antiviral for, like Valtrex.
Yeah.
So unless you actually have problems with it, it's almost like rocking the boat. I see it both ways. I feel like
then they're told to just abstain from sexual encounter
during
an outbreak.
But you can have a prodromal phase, which is when you're actually contagious or shedding and you don't know it.
Right.
You see what I'm saying?
Yeah.
So
it's so up in a.
It's.
Yeah.
So, and then with herpes, there's no cure. So, it's just not a priority.
Yeah.
By the CDC or like organizations like that, because it's not life threatening.
Yeah.
It's an annoyance and a nuisance, and it's said to be painful, but it's not life or death.
Right.
And it's more common than we realized. So, knowing you have it doesn't change anything medically unless you're having issues. So that's why it's not a part of your routine screening. Okay? So, now let's go to the next one. I want to get your feedback on this. Now, HIV. I remember years ago when I was in that clinic, I vividly remember that one of the patients who came in, so check this out. We would get couples that would come in together. You already know where I'm going with this, right?
Yeah.
Appointment on the same day. One gave it to the other.
Yeah.
And I'm just sitting here like, how are y'all this calm? But I remember two couples specifically. One was a younger couple, probably in their 40s. And I think the husband had given it to the wife, and they were just in there getting their treatment together. Like, what do you do in a situation like that, But then I had an older couple one time, and the guy was like older. He was probably in his 70s.
Right.
And I'll never forget, I saw him in the clinic, and he was towards the end, because back then, if you were on Fusion, the shots, back then, this was a long time ago.
Yeah.
That was kind of like one of the last treatments where they had become resistant to different other treatments. And so he was kind of like at the end in the sense of treatment-wise for 20-something years ago. And I'll never forget, probably not even a month later, I was at work, and I looked on the counter, and his obituary was on the counter. Not at the clinic, at a place where I worked.
Yeah.
And I saw his face on the obituary, and I was like, wow. But the word was that he was the grandfather of one of my coworkers, and he had died of cancer.
Oh, wow.
Now, I'm knowing what he really died from, but of course I would never disclose that.
Yeah.
But sometimes people are said to have something else when it was really AIDS.
Right. I think when it first hit, people were ashamed. I think now people are not as ashamed to say I have HIV or I have AIDS or I'm living with HIV. But back then, people were very ashamed. Like, you were shunned.
Oh, yeah.
Like, people were scared to touch you.
Yes, they want to drink.
As if, you know.
Yeah.
If they knew of that. Like, because we wasn't educated on it as much as we are now.
On how you can.
And that you cannot touch it by smiling. And like, it was so bad. Like, people...
They want to shake your hand.
They want to shake your hand. Any of that. Like, thinking if I touch you, you're going to give me HIV. Like, no, that's not how HIV is passed on. So I'm so happy that there's so much educational material for those who really don't understand it, so they won't treat others wrongly for having this particular disease.
And we both know we used to have a very close friend with AIDS. You know, we had a very close friend with AIDS, and we never treated him any differently.
Why would we?
You know what I'm saying?
Yeah, why would we?
And this was a long time ago.
Yeah.
But just to debunk some myths about how you can actually get it, because even though we know and we understand as healthcare providers, some people still like, I don't know.
Yeah,
you know what I'm saying? So, you know, when it comes to HIV, it is not spread through casual contact.
No.
Like, honestly, would you kiss somebody that you know had AIDS?
So if you think about, just hypothetically speaking, I was always told you treat everyone as if.
Oh, well, of course, universal
Right.
precautions for us, yeah.
Yeah. So,
I'm sorry, we should probably explain it to those who may not understand it. So,
Okay.
you treat everyone like they have something until it's proven otherwise.
until it's proven otherwise.
That's just what we're trained to do.
Yeah.
Which is why we wear gloves and all that kind of stuff when we're dealing with body fluids and stuff like that.
But yeah, I've kissed. Now, would I do like a saliva?
Would you
type?
French kiss someone that you know has AIDS?
I don't think I would French
wouldn't.
kiss. No,
I would not.
I kiss you like on your cheek, your forehead, but I definitely would not French kiss.
No, I would not.
So no saliva.
Even though we know. Oh, okay. Well, let's correct this. Okay.
You can't, because
It's a small risk.
especially with sores in
Yes,
the mouth. And
there
things
could be
like
an
that.
open sore in the mouth. Okay. Y'all hear that? We're just taking you to school, you know, because
Yeah.
we love you and we just want to learn together, right? So it's not to shun anybody or anything like that. It's just we just need to know these things, and then you
Yeah.
can make your own decisions based on what you know. And we're not giving any medical advice. We're just we're just sharing a conversation. All right. Two besties having a conversation that you all are included in. So HIV is not spread through casual contact like hugging, shaking hands, sharing dishes, or closed mouth kissing.
Right.
The virus cannot survive well outside of the body. But deep, open mouth kissing only carries an extremely small risk if both partners, this is not going to be your common situation where both partners have significant bleeding gums.
Yeah.
Okay, issues with the gums or open sores in the mouth.
Yeah.
But it's rare. But you know, sometimes you get a sore in your mouth. Just like we had braces and stuff, like just openings in the mouth. You just have to be careful with that. Like if you got an open cut or something like that, you just have to be careful with that, just in general. So, but you can't get it from closed mouth kissing or casual contact.
Yeah.
Okay. You can get HIV. This is another myth that you can get HIV from toilet seats. That's a lie.
Yes. No.
Or from swimming pools. That's a lie. They used to say mosquitoes would give it to us. You
They
remember
did
that?
say mosquitoes was carrying the HIV.
That's a lie. HIV cannot be transmitted by insects, toilet seats, or swimming pools. Mosquitoes do not inject blood from person to another. They digest it.
Yeah, but say they take it.
I cannot stand mosquitoes. And then again, HIV dies quickly outside of the body. All right, here's another myth. Only gay men.
Oh,
We know this is a lie.
such a lie.
Okay. Only gay men or people who inject drugs get HIV.
Not true.
Anybody can get HIV.
Anybody can get that.
Anybody. So
And no, gay men did not start HIV. You remember that was a
that
big
was the
myth.
thing.
Yeah.
Yeah.
No.
So some groups do have a higher prevalence rate, but that's through behavior, not identities.
Yeah.
There are just some groups that have a higher risk behavior-wise. Their behaviors are more risky, so it puts them more for potential exposure.
Right.
But just that's why it's not like gay men or people who use drugs.
Remember, they was thinking at one point in time only anal sex
Right.
caused HIV.
I don't even know. That's because they were associated with gay
With
men.
gay men, yeah. So, not true.
So that's not true, okay? And again, gay men did not start AIDS. That's a myth that came out of fear, stigma, and misinformation in the early 80s, all right? Because that's when it was first identified. The first known case of HIV was actually traced back to Central Africa in the late 1800s, early 1900s.
Wow.
And we won't get into all that, but they do believe it had something to do with chimpanzees. Yeah. Likely crossed from chimpanzees. I always heard monkeys. So, chimpanzees to humans when people hunted and consumed bush meat.
The meat, yeah.
Yep. So it was a process called zoonotic transmission. So you see what I'm saying? So it spread slowly at first, moving through rural areas to cities, then globally through travel, migration, and sexual contact. The reason why it was linked to gay men is because doctors first noticed it in clusters of gay men in New York and San Francisco.
Oh, wow.
So that's why they initially thought that's what it was.
Gotcha.
And it was initially named GRID, G-R-I-D, gay-related immune deficiency.
No way.
Yeah.
Wow, I didn't know that.
Yeah. So at that time, it was ignored that heterosexual groups was getting it too.
Right.
They were just hyper focused on the gay men who were popping up with it, but there was heterosexual transmission at the time too. You know how people choose what to focus on.
Right.
All right. So I just want to take us back to that because this is important. So we're just sharing a conversation. So that's the whole deal with HIV. And again, 87% of people do know their status now. That's a huge improvement.
Yes.
All right.
People are really getting checked now.
Yeah. And living with it. Right. Okay, so now, before we go to the last one, let's talk about herpes transmission.
Okay.
Because some people just don't know. So skin-to-skin contact, there's a net, skin-to-skin contact with an infected area. The catch is even when you can't see a sore. That's the catch.
Yeah.
Asymptomatic shedding is what is medically called, like the phase before you actually realize that you're having it. Right. And herpes is spread by direct contact with skin or mucous membranes that shed the virus. Condoms lower the risk, but it doesn't eliminate the risk because the sores can be present outside of the shaft.
Yeah,
it can be anywhere in the genitalia. All right?
Right.
So condoms lower risk but don't eliminate it because there are areas not covered by the condom that can still spread the infection. And then again, remember, many people don't know that they have it. So most transmission happens from people without symptoms. But you still have people that think they can manage it, and that's one of the reasons why some people don't disclose it.
Yeah.
Well, I haven't had an outbreak in however long, so no, I didn't tell. But there's still this thing where you could spread it
to your partner
without knowing that you're having an outbreak. And that's the risky part.
That's the risky part.
That's the area why you need to disclose, even though it may turn some people off.
Yeah.
You know what I'm saying? Yeah. So many people don't know they have it, and most transmission happens from people without symptoms. All right. It can also, HSV can cause genital herpes, HSV1.
HSV1.
So HSV1, as we just talked about, are the mouth sores. But if you are engaged in oral sex, you can have HSV1 in the genital area.
Gotcha.
All right. So here we go. That's on that. Now let me ask you this. What's your thoughts on erectile dysfunction? I'll let you answer first.
So erectile dysfunction is a condition where, like most men patients that I had, are ashamed, and they would rather have not take their blood pressure medications.
Girl, we not even. Girl, yes.
So some blood pressure medications can cause erectile dysfunction, right?
Yes.
So and a lot of the men patients that I came across that had erectile dysfunction, they would not take their blood pressure medicine.
No matter what, they ain't care. They stroked out.
So I had this one patient one day that came in with his girlfriend, and she was very attentive to his care. And his blood pressure was stroke level.
Jesus.
Right? And so I'm talking to this young man, and I was like, hey, why aren't you taking your blood pressure meds, this, that, and the third? And he was like, because it caused erectile dysfunction.
What was his blood pressure? Can you remember counting what it was?
I can't. It was 2-something.
Oh, my God.
It was super high.
It was, oh, Jesus.
And
was it emergency room or just a regular clinic visit?
no, just a regular visit.
Okay.
And I'll never forget this encounter because the girlfriend was like, I'm going to take care of his blood pressure because I'm going to start making him exercise. He wasn't overweight. Let me just say that too.
Mm-hmm.
I'm going to start making him exercise and make him start eating better, and he'll be fine because no, he's not going to take that med and then mess up our sexual life. So,
oh my God,
I couldn't believe,
pressure,
but
ladies.
she was serious. So I literally look at him and I said, "Sir, let me explain something to you. Your blood pressure is so high right now that you can have a stroke."
Right.
I said, "So at the end of the day, if you have a stroke, you won't be able to have sex with her no ways at this point."
No.
I said, "So either you're going to take your blood pressure medicine, and then you could take an additional medicine to help with the dysfunction." I was like, "Or you can stroke out and then you're paralyzed and then
Or die.
and then you won't be having sex with her no ways at that point."
So basically, his was related to his uncontrolled blood pressure.
Blood pressure, yeah.
And he chose, and I was working at the VA.
She chose.
Oh,
I don't
God.
think he chose. I
Isn't
think
that
she
something?
chose.
So should someone else have that type of decision-making power in your life?
That young man looked me in the face and said, "I appreciate you explaining that to me. I'm going to take my medications." She was hot.
Girl, stop.
But I have to be truthful to him. Like, no, we're not doing that.
Right. And so, of course, when I was at the VA, I had quite a few of our guys that had erectile dysfunction. And, of course, the VA will only let you prescribe like 2 Viagra for the month.
For the month? Just 2? Oh, wow.
And I'm like, okay. So what I used to do sometimes, is give them 2 of the stronger one. I want to say it was 100 milligrams, I think, and told them to break them in half if they could get results with 50. So at least they can get 4.
At least 4, right?
I try to take care of my people. You know what I'm saying?
Yeah.
And that was a thing, and we had to have a special authorization to even get it because it's so expensive.
Right.
That medicine is expensive.
It is.
And basically, unless they had a 3rd-degree heart block, that was like the only contraindication. That was the only reason why you could prescribe the medicine. So blood pressure didn't none of that matter. You could still prescribe the medication.
Still prescribe, But heart failure,
Yeah. But if someone knows that they have erectile dysfunction,
should they tell you?
And from my personal experience, I don't appreciate not being told.
Yeah.
I found out after the fact.
Ooh.
And I just feel like that was deceptive. You know what I'm saying?
Yeah.
I think people should have the right to choose. And if sexual satisfaction is important to you, then, I think that's something that should be discussed because that's not fair. Like, it's not fair. Like, wait a minute. I didn't sign up for this. I didn't even know this. Like, you could have told me this because you knew this already.
Yeah.
It's one thing for something to develop while you're with someone. But if someone knows going into the relationship, and they fail to disclose that with you, that's not fair.
But hypothetically speaking, Bestie, if a young man would have told you up front,
He wasn't young.
Well, young, old, middle age, whatever. If anybody, let me rephrase, if anyone told you up front, "Hey, I just want you to know that I do sometimes have problems."
Then they be saying sometimes when it's all the time.
So would you have at that moment said, "Well, this is over. I'm sorry, that's not what I'm looking for"? No, you would not have.
It depends on if I really like the person.
Right. So, okay, so what if you really like the person and that person told you ahead of time?
Well, if you couldn't do that, then you would need to be able to do something. Like I just don't think it's fair. I think that should have been something that should have been mutually discussed. Not something you find out
down the road.
Down the road after you've made a full-blown commitment to the person.
Yeah.
I just think those hard conversations should be discussed. And I was trying to figure out, like, what's a comparison for a woman.
Dryness.
Like, vaginal dryness, right? But I know as we get older, you know, as we approach menopause and all of that.
Yeah.
You know, we hear about that being a part of, it could be a part of menopause and stuff like that.
Right.
So as you age, you know, that could be possible. But not everyone reaches menopause and has it. Some people have it anyway.
Yeah.
You know, and there was a time when I was in a situation, I was so miserable that I thought I had that issue, but it wasn't me.
It was the person.
It was because I couldn't stand him.
Yeah. It's the person.
So sometimes the vaginal dryness is not because there's something wrong with you.
Well, what about the erectile dysfunction? Could it be because they're not into the partner?
Possibly.
I think it goes both ways.
Yeah, it can. It can be a reason. So it just depends.
Yeah.
Like some people, and matter of fact, I think I have something written down about that, Bestie.
Well, let's see.
Let me see what I got on my notes here. Okay. Because I do think I wrote something down. Let's see here. I got to find it. Y'all hold on here. I know I just had something. Well, here's some of the things about erectile dysfunction. So it affects self-esteem, dating confidence, and intimacy. So this is why some men hide it until the last possible moment. And how, on the flip side, early disclosure, as you just said, it could actually build trust. Like, oh, you told me that.
Yeah.
You know, I'm a very loving, considerate person, I think.
It's things we can do to try to,
You know.
make it happen.
But I know of some people, like I have a friend who was in a situation to where, because what you don't want it to be is like you're blaming yourself for why it's not happening.
Why it's not happening.
You understand what I'm saying? But I was reading something about with erectile dysfunction, sometimes it's because the person is actually functioning somewhere else.
Is that right?
That's right. And I was trying to pull up my stats on that because I did do some research on that as well. But so sometimes that could be why, but then sometimes you have people who automatically assume that that's
the
why.
reason why.
Like, yes. So let me do this. Let's see. The thing is, people don't really. This is based on things that are reported. You know, people aren't probably disclosing this as frequently as maybe they should.
Yeah.
You know, because sometimes people just say, "I'm good."
Yeah. But I think that
good.
happens too when a lot of men have female doctors. It's like they're ashamed. Because like even when I'm going over medications with some of my patients, and I be like, okay, so you still take this, that, and the third, and they be like, well, yeah, but I don't have to take that anymore. You know,
they've been healed.
Yeah.
I see.
And I be like, okay, so you don't take it? No, I just got it on. I got it just in case, but I don't be needing no more. And I be like, okay.
So how about my grandmother and grandfather who were married like 60 years? My mom's parents. My grandmother, get this, y'all, did not know my granddaddy had a pump. He had a whole penile pump.
What?
He wasn't using it with her.
What? She
And
didn't
I think, and I forgot exactly how it went, but I think
the pump goes in the scrotums, so you won't see it because it's inside your scrotum.
But the fact that my granddaddy, when he got a
Yeah.
penile pump,
Yeah.
my grandma would cuss you so bad. They say she clowned so bad, and that. Can you imagine? My granddaddy
how
had
did
a
he have
whole
surgery
penile.
and
I
she
wish I could
didn't
call.
know?
Girl, I wish I could call my auntie or somebody right now because I think I remember that. I remember that, and my granddaddy had a pump, and my grandmama didn't even know.
So you know they have this thing for men now where they can get extra inches and things like that.
Like surgically.
Surgically, yes. They was talking about it on the radio.
I do
one
know
day.
of someone who probably needs to get that done.
Next subject. Next subject. Why did I even mention that without next subject? What's next?
Okay, let's go back to.
Oh my God. I don't. That's another story.
I'm just trying to help people. I'm just trying to help people. So how do they do that? They take it from somewhere else? I have seen something like that.
I'm not sure. We have to research that.
Okay,
I just
well-
know they was talking about on the radio one day, and one of the guys on the radio station had the doctor there, and he was like, "I'm getting it done, but you got to be asking this for about, I think he said, 45, 60 days after the fact. But it literally gives you extra inches."
So I just quickly typed in penile elongation surgery. And I got some information for us. You ready?
Yeah.
You know I'm a nerd. I like to look up stuff. So it's sometimes called, I even called it the right thing,
Really?
penile elongation surgery. That's making the penis longer, for those who don't know the medical jargon. All right? Sometimes called penis lengthening surgery. It's a controversial, I bet it's expensive. I know insurance don't cover it.
I'm quite sure it is.
But it's a controversial and rarely recommended procedure aimed at increasing the perceived length of the penis. The perceived length. So the most common surgical method involves cutting the suspensory ligament that anchors the penis to the pubic bone.
I can't even visualize it.
But let me give you the rest.
Okay.
This allows more of, so think about the anatomy, right?
Okay.
So listen to this. It allows more of the shaft that's normally inside the body to hang outside to make it look longer.
Okay.
When flaccid, so when it's not erect. So why does it matter why does it matter what it looks like when it's not erect?
I guess someone wants to wear those gray jogging pants. You remember we went to that gray jogging pants era? Like,
Ooh,
yeah.
This is funny. But the thing is, it doesn't change the length. It just changes the perceived length.
The perceived length. So the partner won't feel a difference is what you're saying?
I don't know how it...
Because on the radio, they claim that the partner would definitely feel a difference.
Okay, I'm going to get excommunicated for this conversation. But here we go. Well, I think I've already been excommunicated, so I don't think it really matters. Listen, this is the average gain.
Yeah.
Ready? Okay. The whole thing is the erect length does not change much or not at all because the functional part of the penis has not actually grown. Okay. The average gain is 1 to 2 centimeters, which is 0.4 to 0.8 inches. That's less than an inch. And then the erect length is usually unchanged. Now get this. Guess how much it costs?
$25,000.
Just 8 to 15,000
Okay.
for less than an inch.
So
I bet there's some guys who will pay for it.
Can you change your inches or no?
Can you
Can
order
you tell
more
them how
inches?
many inches you want? I'm just asking. It was a whole topic on the radio station one day, and I was like, oh my God.
Ooh. Oh, if you have a micro penis. Have you ever seen someone with a micro penis?
I plead the fifth on this question.
It's
I
the way
plead the
your
fifth.
eyes- No, well, okay. No, seriously, like, okay, wait. I'm being for real, bestie. No. Let me tell them what a micro penis for real is.
Yeah. What's
No,
a
like,
micropenis?
no, I'm for real. I had a child one time that he was like maybe 10 or 11. And it was literally like flush with his growing, like there was nothing there. It was just a little circle. Like, I don't even know how he used the bathroom. But listen to the medical definition of a micro penis, which is a small penis. Like, I said that to say if you have a micro penis, wait, I'm not laughing at that. I'm laughing at the fact that it could be covered by insurance, but then you only get less than an inch. So what is that?
So they can't take like part of your thigh and make you an actual shaft of a penis?
Why would you use your thigh?
Because usually when you do like transplants and stuff like that, your thigh is like one of the muscular areas. They use that a lot for people.
Well, I don't know. Maybe we should recommend that.
I'm quite sure they do that.
Maybe
for
they
people
do.
Who are like micro.
Maybe they do. Maybe they do. So the definition of a micropenis is a penis length more than
Less than or more?
It's saying more. Medical definition, an erect penis length more than 2.5 standard deviations below the average. So it's less than 2.5 standard deviations below the average size for age and stage of development.
Gotcha.
So basically, let me translate this. In a stretched, flaccid length, that means in a stretched, non-erect penis, if it's less than 2.75 inches long, stretched, it's a micro penis. So, 3 inches is about like that.
Yeah.
So imagine it being stretched and it's less than that. That's a micro penis. And if it is less than 3.67 inches erect, which is about like that, that's a micro penis. But I really did have a child one time that I had to give him that diagnosis. Like he actually already, because I think urology diagnosis, he already had the diagnosis.
Okay.
No. I referred him to urology.
Yeah.
I couldn't believe that. Like when I say nothing, I mean I was like, wow, he was overweight, but not like that.
Yeah.
And I did have to refer him to urology. So that comes from hormonal and genetic factors, right? So as again, a micro is not the same as a small.
Right.
Do you think someone should tell you if the penis is small? It's getting serious.
Maybe not, because they're thinking it's the motion of the ocean.
I don't agree with that.
You heard that? You heard of that saying
I
before?
heard that lie.
Okay.
Yeah.
I
It's
know.
not the size of the ocean; it's the motion of the ocean.
Yeah, something like that. But who's gonna tell you up front that hey, it ain't there?
A very honest person. I know someone, one of my friends, the guy she was talking to, told her.
Up front? Initially?
Yep. And that he wasn't circumcised.
Now, the circumcision, you really need to tell the other person. Seriously.
I mean, you're gonna know if you get to that level.
Only because
of the bacteria.
Yeah,
and the risk
we need to know this ahead of time.
But you don't think both should be revealed, discussed? Now, I've had 65, 70-year-old men come to me in the clinic with balanitis, where the foreskin won't retract.
Yeah.
What's the word? Is it balanitis? Hold on, y'all. We got to get our facts.
And it's painful when they try to
retract and so we
it.
have to refer to urology.
Yeah.
Yeah, I got it. So it is balanitis. It's inflammation of the glands, and it's so inflamed that you have to refer them to urology, and then they get a circumcision at 70 years old.
Yeah.
So basically, today we have talked about things that should be discussed. Maybe.
Yeah.
I do think that any type of sexually transmitted disease should be discussed. Definitely. For sure. I feel like if you have an issue sexually with performance, if it's coming to that at some point, if you're going to build a life together, I think that should be discussed.
Yeah.
So that you can come up with a plan together.
Right.
When it comes to penis size and all of that, I mean, I don't know, because different people like different things. So
right.
I don't know if I think that's personal preference.
Yeah.
But overall, I think we just need to be informed.
Yeah.
Right? Especially, we joked around at the end, but for real, when it comes to herpes, HIV, AIDS, and things like that, you need to be aware. You need to have open communication. And with the takeaway today, our takeaway today is when you're going for your STD screenings, which I do every year, like it's a part of our annual.
Yeah.
I always say yes. I don't care. Just say yes.
Do the whole thing.
Do the whole thing, but make sure you ask for the HSV too, or you could have it and not be aware.
Yeah.
Well, this was interesting, Bestie. I hope y'all enjoyed our conversation. We got a little medical on you, but I think we brought it back down.
Yeah.
All right. Until the next time. What do we call this? Secrets in the sheets?
Yeah.
There should be no secrets in the sheets. Bye.
Bye.